This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHD HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning, broadcasting live today from the beautiful Bella in one of the best days of the summer.
It is.
At the shore.
Even though it's at the end of the summer.
That's right. Well, of course. We always save the good for the end, right?
Yeah.
Good to have you with us as always as we bring you Health Watch every Sunday, 8 till 9, our live version here on Talk Radio 1210, WPHT. Dr. Molly Fantasia, as you heard the man say, is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. What do we talk about here on the show? Well, the key is in the title. We talk about health, specifically yours and your families. As far as the overall picture is concerned, we do our best here to help you improve your overall quality of life, and that's why we call it Health Watch. And Dr. Molly is going to talk about the who, what, when, where, why, and how of Innovative Medical Associates, located in Marlton, New Jersey, what they do and how they do it and how it can help you. All of that coming up in the next hour here on Talk Radio 1210 WPHT. 855-839-1210 is our number. 855-839-1210 at any time during the course of the show. If you have a question or a thought for Dr. Molly, feel free to call in and ask. 855-839-1210. Before we get started, Dr. Molly, you wanted to shout out to someone?
I want to shout out to Lana, Richard, and this wonderful therapy dog, Lucky. He was the best. Did you see him peering out of the conference room?
I thought it was your dog.
Yeah,
looks
I know,
exactly
he looks
like
just
your
like
dog.
Gracie, right?
Yeah.
So it was quite a little. She came in for the consult, and she's a registered nurse, and I won't say for how long, but it rivals my wonderful nurse, Barbara, and they actually went to the same nursing school. So it was a really nice little reunion for Barbara and Shay, and it was very helpful for me. And we'll talk a little bit about some conditions that came up this week and what people are doing about them. So she was a great gal.
And since you've been doing the show, especially a lot of consults, and you meet a lot of new people.
I do meet a lot of people in the consults, and sometimes they're pretty tragic, John. Sometimes
sometimes I see you coming out of meetings, and I see your face, and I said, that had to be a rough one.
Yeah, and you know what? I really tell people, boy, wouldn't it be just wonderful if people came in to see me earlier rather than later in the continuum of their challenge. And I did have one wonderful one this week like that, and we'll talk about her.
Okay, all right. 855-839-1210 is our number here on Health Watch. And let's talk about innovative medical. And I always say the who, what, when, where, why, and how. I mean, we talk about this every week, and invariably you'll get a call from somebody, and they'll say, well, what exactly do you do?
Well, here's the thing. So let's start with that because it's hard. It's a hard concept. So we are a collaborative of healthcare providers who've come to understand that there are several ways to help a patient in terms of their condition. And in doing so, we really subscribe to the philosophy that we can do anything that a primary care facility can do. So if you need an antibiotic, you need a Z-Pak, you need anything, you need high blood pressure medication, our docs can prescribe that. But actually what we like to do is really look carefully at the pharmaceuticals and use the least amount of pharmaceuticals to help keep you medically safe, but also augment that with the hydration therapy, with the nutraceuticals, which are natural substances.
And in many cases, the hydration would not necessarily augment the pharmaceuticals. Yes.
Right. And so as a result, our patients tend to do better in terms of overall quality of life rather than suffer the side effects that we all see on our prescription bottles and in that litany that comes with every bag that you go to the drugstore and get. Yeah. So it's one of these things. And with more and more drugs coming out, it seems to me that more and more drugs coming out commensurate with how many side effects. It's just amazing to me.
Yeah, I know.
there are more side effects than ever. So it's, let's talk about this. This is an old philosophy, and I'm lucky enough to have folks who are working with me who understand that more pharmaceuticals are not necessarily better. So if we can treat a patient with the least amount, help them through a particular challenge, and keep them on the road to quality of life, that's what we like to do.
Okay, I believe we have a call, and Jim, I didn't get. Was it Phil or Bill? Phil in Chestnut Hill. Phil, good morning. Welcome to
Phil.
Health Watch. You're on with Dr. Molly.
Yeah, hi. Good morning, Dr. Molly, and to the host. I have a concern. I've had an A1C done, and I've been told that I'm in the pre-diabetic range. I'm just wondering, aside from...
Phil?
You there?
Did I lose him? Oh.
Did we lose him, Jim? Oh, he's gone.
Oh, wow. Let me tell you something. That's a good question, though, John. Let me try to answer. He's probably asking, is there anything more natural he can do to help him stay out of moving towards the diabetic range? First of all, let's talk about what the hemoglobin A1C is. It's a 3-month marker that tells a person where their blood sugar is, high, lows for that 3 month. And there's a range, there's a normal range, and you want to stay within that normal range, because if you do go a little higher, it means you have a predisposition. It's why they call it pre-diabetes. You're not quite diabetic yet. You're not in the diabetic range, which you can show too, but you're in the pre-diabetic range. So if Phil changes his diet, starts limiting some of his high carbs, which means shorter acting carbs, and starts looking at also augmenting this with some natural substances, a few right off the top of my head. I might want to look at things like Gugolipid. There's a ton of things, all right? If he were a patient of ours, we would switch up his hydration protocol to actually reflect utilizing things that would help him maintain a lot more level blood sugar. But again, this is the kind of thing that lifestyle and natural substances can help a person stay off of the diabetic meds.
Okay, you want to take him back? He's back on.
Good.
Okay.
Hi,
All right, Phil. Let's pick it up. And Dr. Molly just kind of answered a little bit for you, but go ahead. Continue with what you were saying.
Go ahead, sir.
Yeah, hi. Greetings again. Can you hear me?
Yes, sir.
All right. Thank you very much. Listen, I've been told that I'm in the pre-diabetic range. I know that I've gained a lot of weight, maybe 50 pounds over the past year.
Right.
I am more sedentary due to a back problem, and I'm just wondering what I can do other than, of course, limiting carbs and whatever. If there's any natural substances I can take that can help.
Sure. There's many natural substances. However, what I would want to do is I think you're on the right track, Phil. That's very good that you think. And as you heard, I think you heard me say, you really need to change a little bit of your lifestyle. I would like to know a few other analytes that you had done at the same time to see if we could help you. I can tell you that we have many patients like you who never move into the diabetic range if they follow changes in what they're eating and watching the carbs that they're taking in, and possibly taking some nutraceuticals, meaning oral. But mostly, we're able to do this with the hydration rather quickly. I find it interesting that you gained the 50 pounds because of some back trouble, which means to me you must have pain. Am I on the right track? Do you have pain in the back?
Yes, indeed.
Okay, and what is that from?
Knees.
What is that from? Is it
I'm told spinal stenosis, scoliosis.
Spinal stenosis, yeah. Okay.
I'm in a neck brace because they say the bones of my neck had started deteriorating.
Oh, my goodness. You know,
they wanted to do a rod thing, but I said, no,
you're probably
fine.
You know what? I think you're a smart guy to stay away from surgery, particularly with some of the morbidities you have. I would tell you that I think you ought to look at some things to help limit the arthritic pain, and that I would look at some nutraceuticals. If you call my office next week, not during the weekend, if you call my office next week, I'll have Barbara try to help you a little bit. As I said before, you're the kind of patient, though, I would love to have in my chair because I think I could help your pain level. I think I could help hold down the inflammation, which I'm sure you have. I would probably put you on some glutathione, alpha lipoic acid, in addition to using it in the IV. So please call my office, will you, my friend?
All right, Phil. Good luck with that. Thanks for the call.
God bless you. God bless you.
Appreciate it. Good luck.
God bless him.
This brings me back to many years ago when you and your docs diagnosed me high blood sugar. And you said, okay, now you're either going to do this or you're going to have a multitude of problems beyond this.
Right, exactly.
And cut down the diet, cut down the sugars,
right.
and some small doses of medication.
That's right.
Right.
And I think it's been fine.
Yeah.
And you were not pre-diabetic. You went straight to diabetic.
I didn't play around, right?
So Phil is in that sort of nebulous area where it's pre-diabetic. You know what I believe? And again, this is just me talking as a scientist. Pre-diabetic is like being diabetic.
That's exactly right. It's like being pre-pregnant.
That's right. That's right.
Okay.
Okay.
All right, coming up on our first break of the morning, our show is Health Watch every Sunday, 8 till 9. Our live version here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. 855-839-1210 is our number, 855-839-1210. We're back with more of today's edition of Health Watch after these words. Welcome back to Health Watch. Operators, as always, during the show, standing by at Innovative Medical. And their number is 856-489-0505. That is the number for Innovative Medical, not only now, but during the week. You want to call them during the week, you can call them now, whatever. 856-489-0505. And again, Innovative Medical Associates, Marlton, New Jersey. When you call, if you want more information, they'll be happy to provide it for you. And if you'd like to make an appointment, and that's really what can help you the most, sitting down with Dr. Molly and discussing your issues and your situation. And again, you schedule that by calling 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And as always, we suggest that you like us on Facebook. Always a good thing, liking us on Facebook. Health Watch is the show every Sunday, 8 till 9, Talk Radio 1210, WPHT, our number in the studio right now. And always, as we tell you, it's a good time to call early in the show because later on, well, happens every week. We can't get to the last caller. 855-839-1210 is our number here. Dr. Molly, before the show, you and I were talking, and we were discussing people who come in for the consult and bring you their supplements. And,
Yes.
and I said something to you, and I said, well, why don't you do this? And you said, well, really, they can take 1.5 zillion supplements.
Great.
But nothing is the same as the hydration. Could you
Exactly.
explain what you mean by that?
Well, sure, because what happens is, although we love our patients to take certain supplements, and as you know, we know a whole group of product, but we don't actually sell the product in our facility. But there are a lot of good brands out there. But I got to tell you, you can take a whole lot of that before you get what we put in your bag. And one of the things that I find is most people who come to me are not just coming to me for well visits. Yes, I have several athletes. Now, they need a regimen to go on the road with. But you notice when they're home, John, where are they? They're in the chair
That's
with
right.
me.
No, that's right.
So it's because the amount of the hydration and the mixtures that I can put in of the nutraceuticals that are more appropriate for you and what you want to accomplish and bypass any fillers, etc. It's just a more direct way to get it, John.
And that's
more
why
effective.
That's
It's more effective.
right. And as you've often said, you don't filter it through your system. It goes right into
to wherever you need it. And the question is, here's the other thing. I find that most people come in and they really are just taking anything that they read about that says it's good for such and such. Well, that's no way to do this. You really should focus in on what it is you want to accomplish. you know and I know this isn't holy water either. It takes time. So just think about the difference in the amount or the dosing or the frequency that you have to take some. I had one patient who had to take, in order for the particular substance to work, they had to take 10 of these particular capsules a day. And at 10 capsules, they still weren't getting what I give them in one sitting.
That's amazing, isn't it?
No, but it was.
But people don't realize
story.
that.
Right,
they don't realize that.
And really, what I want to do is I want to most effectively change your quality of life. If you're having pain, I want to help reduce that pain in a way that is consistent for you, not just one day hit or miss, but consistent. So do we say take some things outside of what we do? Of course, but that only augments what we're doing.
You know, it's interesting. People have come over to my house, and I have a couple places where I have the supplements that you and your docs have prescribed. They say, how many supplements do you take? It's probably 5 or 6, but so what? I mean,
5 or 6.
But now I'm in twice a week for hydration.
Right.
Because that's what you recommended.
Right. But you're having less pain.
Yeah, exactly.
You're having less pain.
Exactly, yes.
And we certainly are getting your blood sugar under control.
Yeah.
And then we're not even talking about your other more comorbidity. So believe me, John, these are the kinds of things. So when I have, like, cancer patients are a good example. We, of course, are going to say, we want you to take a certain amount of supplements outside the IV therapies that we're doing. But again, I want them to be appropriate for you, and you want to take them in the way that we help you, say, manage. So certain things are taken in the morning, certain things are taken in the afternoon. There's so much to that. And look, I want to help people the best way we can. And if it's oral, all they can do, I take the time to do it. But I'm always a little suspect because it just doesn't seem to do the trick.
All right. Tell me when it comes to hydration, what's the proper dose? What's enough? Is there too much? Because people don't really understand
here's
that.
Here's the deal. Look, can there be too much of one substance and not enough of another? Sure. Bottom line is you need somebody to help you decide. Look, there are a lot of pro forma formulations out there for hydration therapies. You're not getting that in my facility. All of our recipes are made from spec, under spec from my years of experience and my docs allowing me to really do this kind of therapy in a way that effectuates the change. And you know what? The proof of the pudding is in my patients.
Yeah.
Come on in, let's talk, right?
In other words, and we've talked about this before, the other day, I mean, it was almost standing room only. I'm sitting there and I'm looking at all the bags and I'm saying, well, wait a minute. Mine is like a bright yellow. That one is an orange. This one was a dark yellow. And I'm thinking to myself, everything's custom made, right? So everybody has a different bag.
Everybody's getting a different kind of treatment. And again, that is because I want to effectuate the change for that particular patient during this particular situation. A good example of that is our cardiac program. Chelation has been the mainstay. There is a pro forma formulary for chelation, which is use of the EDTA. However, I've done something a little different in that I give patients, in addition to that, certain cardiac nutrition while they're getting the EDTA. And that's going to vary depending on what kind of challenge you have. So, for example, if the patient comes in and they have congestive heart failure, obviously I can't give them 5,000 cc's of fluid, right?
Right.
So I got to cut that down, but I may want to give them some D-ribose as well as some of the other things that are in traditional chelation bags. So it's really an art to this. This is the art of hydration therapy. Not one size fits all, and it's very particular for a particular patient and condition.
Now, we've talked about vitamin C.
I love vitamin C.
Is there another common, ingredient to what you do besides vitamin C?
There's a million of them.
Okay.
B vitamins, we spoke about that last week.
Yeah.
But there's a lot more than that. There's a lot of quote-unquote
we would take
common.
the rest of the show for you to tell us that, right?
We could really go through, what we could do someday? We could take the entire nutraceutical PDR, which is like the PDR, which is the prescription drug desk reference that physicians have. There's actually one for hydration clinics that are medical, not spa-like, but that people who really look at functional medicine. I could take the whole book and give you a whole thing, but it would take probably the rest of the year.
Okay. So
we don't want to do that.
No, well, maybe someday you'll have a clinic and we'll invite people to come over.
Yeah, that'd be fun.
Okay. What is the AAEM? What is that?
Oh, the American Academy of Environmental Medicine. And I just was inducted into that about 3 months ago.
Okay. Is that something new? Is that a new organization?
No, it's been around a long time, but I've really been studying for it, and I piqued my interest. In particular, it's been piquing my interest because I've been seeing so much of autoimmune type disorders that I believe are truly related to outside stimulus, and maybe we'll talk about that as we get into the next segment. But the American Academy of Environmental Medicine, for example, we had a situation where a particular small company contacted me, and one of their executives was having a real problem with sinuses, and I don't know, they felt like they had allergy testing. They came in to see me, and the president of the company called me and said, "Listen, do you think I have a mold problem?" I said, "Well, that's easy. I can refer you to a company that I know. They can go in, test for the mold. I can review the test, and then we could outline something for your particular person." And we did, meaning a treatment protocol along with my docs, and we did do that. So, yeah, it's been around.
Does this have anything to do with COVID and all of that
Well,
stuff?
COVID's a whole other story, but
Right.
It was also one of the impetus for me to do this.
That's what I thought, yeah.
Because I am so... I think I'm overwhelmed like everybody else is. We've been stuck in the house and stuck since March, right?
Yes.
Isn't that about right?
Yeah.
And I'm thinking to myself, great, so you have your mask on and you're then, but why are you still having symptoms of other types of symptoms when you're really being so careful and this and that? You know what? How about it might be mold and not COVID at all?
Yeah.
So really, there was a lot to talk about in this segment.
Okay, we're coming up on a break. We'll continue that discussion after the break, and we'll be talking about some other things. And, of course, we always invite you to call in if you have a question for Dr. Molly at 855-839-1210. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, our number here, 855-839-1210, with Dr. Molly Fantasia. I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. Before we get into what we're going to talk about, I just want to remind you that if you miss any of our show in the morning, we try to make it as convenient for you as possible. We have our Health Watch replay, and that's Sunday afternoon, 4 till 5, right here on Talk Radio 1210 WPHT. Every Sunday our show repeats 4 to 5, so if you miss any or you heard it, you want to hear it again, tune in. Now I want to remind you that operators are standing by as they always are when we're here on the radio at 856-489-0505, 856-489-0505. When you call, you want to get more information, they'll be happy to provide that. And also, if you want to sit down in person and meet Dr. Molly, which is probably the most effective thing you can do, all you have to do is call right now and make the appointment, 856-489-0505. Again, 856-489-0505. You want more information as well, check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Health Watch is the show, Sundays 8 till 9, the live version here on Talk Radio 1210. WPHT. We're going to go to the phones. We're going to talk to Gary in LBI. Gary, good morning. You're on with Dr. Molly.
Hi, Gary.
Good morning, Dr. Molly. Good morning.
Hey, Gary. Nice to hear your voice.
Yeah, it's Gary and Jan on Long Beach Island.
I know
got a
it is.
question for you.
Sure.
One that popping up lately, and I thought, boy, I better call you about this. One of our dear friends is starting to show signs of age-related dementia, and more, I'm really starting to worry. And I said, boy, I really should ask Dr. Molly if there's something that she could do for her And on that question, at the end of that question, I will hang up now and listen to it on the radio.
Oh, thank you. Hey, Gary, you know what? I missed you last week. We
Yeah,
all your gang, your whole gang was there talking about you. So, you know, you
know,
have a medical
birthday.
home now, honey. Okay. God bless you
I know.
both. God
Thank
bless
you very much.
Bye-bye.
Yeah. Gary, you're famous
Right.
already.
Thank
He's
you.
famous already.
Yes,
all right?
he is. Thank you. Yeah, dementia is an interesting thing. First of all, you know, what we would want to do is reduce the plaquing, reduce inflammation. So there are certain things that I would use for that. But in addition to that, I might use things. There's a supplement out there called Neurotropic, and when Gary comes in this week, I'll talk about that. But in our IV for that, we use something called vinpocetine, which is an herbal. I would use certainly alpha lipoic acid. There are several things. I think the earlier someone gets in with the dementia or some forms of dementia, like maybe just forgetting their keys, that kind of thing, the better off they are. The other thing, John, you know what else I would use, don't you? Vitamin C.
Yeah.
Even though you would think, because of the high antioxidant property, not necessarily in the oral supplement, and there are several oral supplements. And I would also go back on Dr. Perlmutter's work, and he's been around for a long time. I would probably want to review diet, maybe talk about reducing grains, these kinds of things. He has a book out called Grain Brain, and I would want to look at what the diet's like. I'd also be using alpha lipoic and reduced glutathione, and there's a specific kind of way to deliver the reduced glutathione for someone who's got neurological issues, including the dementia. And you know what else, John? I'd use stem cells.
Which have seemed to be more and more prevalent now. I'm seeing ads everywhere.
I'm using it in our facility right now. You know, I have that wonderful young girl who comes up from Ocean City, and she has a neurodegenerative based on Lyme disease. And last week, we delivered stem cells for her. She is standing up. Now, I'm not taking full credit for this. The good Lord needs to take the credit, and her physical therapist. But she's standing up from the wheelchair. Now, you know she came in on a stretcher, if you remember that case.
Yes, I do remember.
She's another case like that. So I think that there's stem cells that can be used, but you want to use them carefully. So there's a number of things we would do, and we do it IV.
Right. Okay, 855-839-1210 is our number if you have a question for Dr. Molly. So last week I asked you a question about, what are you seeing the most of or more of? And we kind of got into something else and we never really finished it. But it's, what is the answer to that question?
Well, I would say we're seeing, of course, I told you cancer being something, but autoimmune conditions in general. Now, we believe that autoimmune, many times it's caused from disruptors, whether they're substances, things that disrupt certain systems, whether it's neuroendocrine disruptors or immune disruptors. And by that, I mean things that come in from outside, like viruses. You mentioned COVID. That's a disruptor, which is why, we don't even know half of the side effects of corona and the long haul. I told you that last week.
That's right.
Right?
Yeah.
So they disrupted, in one case, one of my patients' endocrine situation where his testosterone dropped to a terrible level. So disruptors can be myotoxins, which are toxic compounds that can be made from mold, fungus, viruses, and they generally enter the body via ingestion, inhalation, absorption in the mucous membranes. But I want to focus actually on the myotoxins themselves, meaning mold and fungus. They mimic symptoms when we have poor indoor air quality. And why that's bothering me so much is because so many of my patients are stuck indoors. And, we get their particular condition under control. And I wonder why we're seeing all these secondary symptoms. And that's what really started me on the path of talking about environmental medicine. I was studying it for the year before, but it came home to roost since Corona.
Right.
And you find symptoms like respiratory problem, decreased energy. I want you to hear how nebulous this is. Sleep problems, neurological, again, even like a little bit of the dementia issues, vision, GI problems, nerve, muscle, and joint symptoms, weakness and pain. So it's symptoms of unknown origin. So isn't it interesting that, we may be on top of the condition that has put us in the house more, but we may then have some secondary problems as a result of being in the house.
That's right.
All right. Yeah. So here's the deal. You've heard me a long time ago talk about sick building syndrome. And a little bit, I mentioned it about a particular commercial situation that I was involved in. But you can have sick building right in your own home from water damage, right? There can be invisible mold growth. You can have it in your ventilation. So these kinds of things live on hard surfaces. They can live in the furniture. The spores can live a long time. You really got to treat not just the patient, but help them treat the environment. And so it's an interesting situation.
So you're seeing more and more of this.
Yes.
And Corona may be a side piece.
Right. It may have caused them to stay home.
Right.
But I'm telling you that we're seeing more and more autoimmune type situations develop because they're stuck in indoor air quality that's not so good, which is another reason why you ever hear everybody with this corona open up the windows, right? Because you want to have air coming through. Think about it. Think about this. So, of course, we want to look at this, but also we got to look at food source too. That's another interesting thing that people don't think about because there are certain foods that can promote mold growth, and that can be grains, peanuts, coffee, certain fermented foods. One of the things I like to say is, how about your beer, guys?
Yeah.
Okay, so maybe we got to go to organic. But these are example of myotoxins that are out there. So my thing is that we've developed the protocols for this. The other thing is, think about this, John. The immune system is like a pendulum. When it's in the middle, it's like Goldilocks, just right. But if it swings too far to one side or too far to the other, you end up having a lot of symptomatology. So your immune system, though it's made to fight off these invaders, including mold, viruses, etc., if it goes into overdrive, the pendulum swings the other way and the body starts attacking itself.
Oh, that's the
where,
problem.
Right.
Yeah,
so,
right.
For example, I've seen patients, one of the patients who came in to see me this week, I'm fairly confident that her psoriasis is psoriatic psoriasis, which means it's an autoimmune disorder. So, what triggers these things? That's why I'm bringing this up. What triggers this? And the more I'm looking at this, the more I know our lymphatic system is very involved in helping us stay safe, whether it's from the coronavirus or everything else.
Okay, we're going to pick that up after the break. Coming up on our final break of the morning, we still have time to take a couple of questions. If you have a question for Dr. Molly, 855-839-1210. 855-839-1210. Our show is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi, coming back with more of today's Health Watch after these words. Welcome back to Health Watch. Operator standing by right now. I'm sure you may have, listening to the show, and you're a little bashful, you don't want to come on the radio, but you can call the operators and they can give you more information. 856-489-0505. 856-489-0505. And they will be there after we leave you at 9 o'clock this morning. Just because we're off the air doesn't mean the operators are going home. They're working all day, okay? 856-489-0505 is the number. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, or if you didn't, you want to hear it again, it replays this afternoon, 4 till 5. Health Watch replay, 4 till 5 every Sunday right here on Talk Radio 1210 WPHT. It is Health Watch every Sunday, our live version 8 till 9 right here, Talk Radio 1210 WPHT. Let's go to the phones. Tony's in Port Richmond. Tony, good morning. You're on with Dr. Molly.
Hi, Tony.
Good morning, Doctor. you've been talking about this increase of autoimmune disease.
Yes, sir.
As a retired engineer, I've been really researching this influx of 5G. There seems to be a lot of concern out there. These micro-millimeter waves have apparently have been doing or could do some disruption to the DNA molecule, which and I've read a lot of other things. The billions of dollars that they've spent in researching this, they haven't spent 1 cent looking at human response to this. So,
you're preaching to the choir. I agree with you. I think that and the more I'm looking at, and again, I won't pretend to have the expertise you have, sir, but I'm going to tell you, the more I look at this from the perspective of my patients, the more likely, and I discuss this with my physicians, and of course, you put 3 physicians in a room, you get 4 opinions. In the very beginning of all this, we heard things like, oh, it's in their head. But you know what? It's just too much coincidence that these folks, you find out that they're all taking this, they all have their cell phones up to their ears, they're all trading them in for the 5Gs. We're all exposed to all this electromagnetic stuff. I gotta believe there is a situation where there is a dysregulation of some type that happens, and it's disruptive to certain systems. I believe it's definitely disruptive to the endocrine system, because why do we have so many, in my clinic alone, it's an interesting thing. I have guys who are athletes, etc., really, really work out, do all this. Why do we see such a decrease in men's testosterone today, right? Hormonal stuff in the water. Yeah. Go ahead.
Because they're carrying the cell phones in their pocket.
Exactly.
Breast cancer, women, stick the cell phone inside their bra.
That's right.
This is really... the numbers don't add up. It doesn't pass a spell test. And everybody is willfully blind. We had the Senator, Bloomberg, from during a Senate hearing, ask these people, how much money have you spent in biological research? None.
Well, I'm with you, and I can tell you this. The other thing is, you and I both know, we need oxygen. Oxygen is necessary to kill all these outside invaders. Oxygen is necessary. Don't you think that there's a disruption? That's one of the reasons why I use something called NAD, which is an oxidizer. I have to tell you, it's pretty scary to me, and I'm sort of glad you brought it up, because you know what will happen in my clinic. They'll come for me for just saying I agree with you. But I do agree with you, sir.
Wear the mask reduces the oxygen level below the EPA standard.
I understand.
Yeah.
But you know what? We're betwixt and between here. We've just got to start using more common sense.
Tony, thanks a lot for the call.
Thank you, Tony.
Appreciate
Thank you.
it.
Please call my office. You're a smart guy. I'd love to have you in on a panel or something.
All right.
That'd be great.
Couple of minutes left. Thank you, 855-839-1210.
Interesting.
Yeah,
it's interesting when you have a guy who's an engineer who calls you, and this is things that I see every day.
Exactly. I know you wanted to pick up on
some patients or
the immune system. You were going to talk about mold and things like that.
Well, here's the thing, John. I have various protocols, but I want to go back to our old friend vitamin C for just a minute, because vitamin C we use in a lot of our environmental protocols for the autoimmune. And the reason being is vitamin C really turns to hydrogen peroxide, which then in turn absolutely increases oxygenation to the tissues. And oxygen can really help kill these pathogens. It's necessary to do so. And this is one of the reasons why I use it.
Okay. Back to the phones we go. Jonathan is in Maple Shade, New Jersey. Jonathan, good morning. You're on with Dr. Molly.
Hi, Jonathan.
Yes, good morning. Always love your show.
Thank you.
Very nice.
I heard a book about the dirty electricity.
Yeah.
And that's the name of the book. The name of the book is Dirty Electricity. And these fluorescent lights, even in hospitals, can cause the nurses to have breast cancer and stuff, and there's filters they can put in, and so
I agree. I agree, and thank you for that, because it's something that we have tried to do in our facility. We've also done a whole lot in terms of clean air at this point.
Yeah.
But I've got to tell you, you're absolutely right. And I think we can't be cavalier about our conditions in terms of our indoor air quality. So God bless
Jonathan,
you. And
thank
you,
you.
Jonathan.
Thanks for the
I
call.
want to put him on the panel too.
Yeah.
Thank you, Jonathan.
Yeah, our last
Have a
two
great
callers
day.
are on the panel, right?
Yes,
Okay.
exactly. Thank you.
All right. We got a couple minutes left of the show. I know you wanted to talk about an update on a couple of your patients.
Yeah, right.
Which have help from you, but they maybe have help from somewhere else,
Oh
too.
yeah, right.
Okay.
I believe in good Lord has helped me with Sister Fran, who's a wonderful sister, and her blood work came back, and she's doing great. She's doing absolutely great. Her traditional physician said, "Oh my goodness, what we've done so far is great." I have to tell you, what she's done and what the good Lord has done, and a little bit of what we've done at our facility, helped her get over this hump. But she's very careful about her diet, John.
I know she is.
I know. And
she
then
sat next to me the other day.
Yeah,
we
she
were
can.
talking.
She can give it to you.
Yeah.
And the other one, of course, is Pastor Matt. He's doing extremely well, and he doesn't mind us talking. He has a bout of cancer. He's doing well. He stopped his therapies for the moment. He's in what they call a moratorium on that. He's feeling good. He's doing his church duties, and all around all right. I have several other the cancer patients doing as well as can be expected. I had a couple little setbacks, and that's expected, particularly with these immunotherapies.
When you're talking about your cancer patients, now are these patients? They're doing your hydration therapies, but are they doing traditional stuff?
Many times they are,
Okay.
and I had an interesting patient come in this week who was just diagnosed with what she said was a very small tumor in the breast, and very smart girl, I have to tell you, came over from Philly. Very smart, and she said, well, I'm not getting this out because I don't want to do the radiation. And I said, just a minute. I have a very good friend of the clinic who is a surgeon. I would like her to do a second opinion, because you know what Dr. Molly says. If this is small, can be contained, get it out.
Right. That's
Get
right.
it out. She had the CT. She's doing okay. She doesn't have a problem in the lymph nodes. Let's get it out and sit in my chair. So I got her an appointment with the surgeon this week coming up. She came in last week. She has an appointment on Tuesday, and I'm looking forward to that case.
You have often said, and you said it to me one time where I had a situation, you said you must have the surgery.
Well, in that case, it was pretty bad.
Yes.
Yeah.
But
And
you've
I'm
often
saying-
said that.
I'm saying if you can have it out, and you've already been diagnosed by either some type of biopsy that it is a cancer, get it out.
Yeah. And we're going to leave them with that thought, okay?
Oh,
time flies when you're having fun. See that? That is going to put the wraps on another edition of Health Watch. Don't forget, if you missed any of this morning's show, you can catch us again this afternoon. It's our Health Watch replay every Sunday, 4 to 5 here on Talk Radio 1210, WPHT. Also, operators are still standing by, and just because we're gone from the air doesn't mean they're gone. They're there. They'll be there all day. 856-489-0505 is the number. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. Don't forget the website, innovativemedicalassociates.com, innovativemedicalassociates.com, and also we ask you to like us on Facebook. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, fabulous Franny, delightful Dee, and of course our nurses, Jess, Crystal, and our medical assistant, Kathy, I'm your host, John DeMasi. Thank you for listening. Always a pleasure. Have yourself a safe week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9 a.m., the live version, right here on Talk Radio 1210 WPHT. You take care.